Okay, so hi guys, how are you doing today?
Good.
Um,
How are
I
you?
I'm good, thank you. I just wanted to start off by saying thank you so much for joining me for this consultation of Cash. I'm just going to be going over his diagnosis and a little bit more information about therapy options and AAC devices, and we can get into more of that a little bit later, but this is about childhood apraxia of speech. So let me move on. So this is Cash, your child, 3 years, 9 months old. I'm going to show this little video. It's a little snippet of a little speech sample we did with him before this consultation, just so you guys can see what we were doing.
Okay, Cash, can you tell me how old you are? Yeah. You're 3? Wow, can you tell me your name? Yeah. What? Your name's not Dad, silly. Can you say Cash? Good try. What did you do today? Yeah. You swam? Yeah. Swimming? Can you say bubble? No. Bubble? Oh, you blow? You blew bubbles in the water? Yeah. Can you say bubble? Yeah. Say it. No. Bubble. Okay. Fallon too? Yeah. How old is Fallon? Yeah. 1. Do you guys like to go swimming? Yeah. What else do you like to do? Truck. Truck? What? Oh, the park? Yeah. You like to go to the park? Can you say park again? Yeah. Park with a park. Good try. What's your favorite thing to do at the park? Play. Play? Like, like, play. Play on the slide? Like, that, um, you like Dad to come to the park? Yeah. Me too. Wait here, where are you going?
All right, I just wanted to show that little snippet. Let me get back into the screen here. So before I get started on any more information about childhood apraxia of speech, does anyone have any questions right off the bat? Are we doing okay? Good, okay. So let's move on here. So I just wanted to start by discussing kind of the things you might be hearing. And if you have any questions throughout this presentation or information, please feel free to jump in and ask at any time. And also I might ask you guys a couple questions just to get a little bit of background information. So I'm going to start off kind of discussing what childhood apraxia of speech is, some normal signs you might see in it, some treatment techniques or options that we might use in therapy, and some at-home work you guys can be doing with Cash, as well as some AAC technology that I would recommend. So before I give a little bit of a definition, I wanted to ask if you guys had any prior experience with someone in the family with childhood apraxia of speech, any friends with children, or if you guys have heard of childhood apraxia of speech before.
I haven't heard that that's like what it's called, but I work at a daycare, so I'm sure I've interacted with kids that have had it. I just didn't realize.
Right, some prior experience with that a little bit. So I'll start off just to give a little definition. So this does fall under the umbrella of speech sound disorders. It is primarily a movement disorder and a muscle tone impairment. So I like to describe it kind of as if you think about, when you're thinking of a thought and you know what you want to say and you start to say it, you use your articulators in your mouth, your tongue, your teeth, your jaw, everything like that to move, to speak those things. A lot of the time with children with childhood apraxia of speech, when they're thinking, they know exactly what they want to say, but it's almost like there's a barrier. So when they try to say it, they can't really get their articulators to move and in the correct way. And so it can cause some issue with speaking and it can be very frustrating for them. It is the core impairment is planning of speech. And I like to use this little diagram over here to kind of explain what Cash might be thinking, just because sometimes it's hard as a parent to comprehend kind of what's going on. So it starts up here with add a thought. I know exactly what to say. So he might see a cat and say, I see that cat, or I want that cookie. So he knows he wants to say that. He knows all the sounds, he knows all the words, but then what happens with apraxia of speech is my mouth, tongue, and muscles are preventing me from producing that sound clearly. And then obviously, hopefully through some therapy, if you guys choose to put him into therapy, he would learn how to move those muscles. It's a very movement-based therapy to learn how to kind of get those articulators into the right place for that speech. And then hopefully up here later, he would speak up and know exactly how to do that in a proper movement sequence. So do you guys have any questions right now? Good. So I like to include this slide. These are just some normal signs of childhood apraxia of speech. As Cash is 3 years old, he's going to start talking more. He's getting into the school age. And some parents can start seeing some of these things and get worried that there might be something else going on. But I always like to add these just to ease mind. So if you start seeing some of these things, you know that it's very normal with his diagnosis. So the first thing is inconsistent vowel errors. I like to describe this as when they're speaking, they might use a word that has a vowel and they say it right the first time, the second time, and then you ask them to say it again and it will be completely different. This is a very common characteristic in childhood apraxia of speech, and it's very normal to see. It's also something we like to work on pretty early in therapy just because it can cause unintelligible speech, which is important, especially as he is going to start communicating with people that aren't his parents and they might not understand. The length of time between syllables and words are longer. This is very common as well as they're processing what they want to say and trying to get it to their articulators with that barrier. It can take a little bit longer for them to work through that process. Prosody, I like to describe this kind of as the way I'm talking, I'm kind of moving my voice up and down with natural speech, and children with childhood apraxia of speech kind of can have trouble. Not every child will, but some of them do. Just it kind of comes out sounding a little bit more robotic. And we like to work on that earlier on in therapy as well, just so they have a little bit more of a natural sound. I also have a video I'll show you guys at the end of this little slide, just so you can kind of hear an example of what that would sound like. Groping of sounds. This is kind of the child I like to describe as reaching for sounds. It's almost like they know what they're wanting to say, but they're struggling to get there. And that can be very normal. And you can kind of see the struggle, but if just helping them work through that and getting them to where they need to be is helpful. And finally, slowed speech. This kind of goes along with number 2, just as they're processing those things and trying to move them, it can take them a little bit longer to get their articulators to move in the correct way. So I'm going to show you guys this little example of this little boy who has childhood apraxia of speech as well. And you'll see kind of his prosody.
What are you going to do with that truck?
Need to wash it.
I need to wash it.
I need to wash it.
Wash the truck.
Wash that truck.
Ooh.
So you can hear her or his mom's voice kind of moving up and down, kind of that natural flow of speech, and he's kind of staying at more of a monotone tone. And this is very common for children with childhood apraxia of speech. We like to work on it. And then I'm going to show you guys the end of this where he's kind of gone through some therapy and you can see he's working on his prosody a little bit more.
Car you want?
I want this one.
Very nice. Beautiful. That raced all the way down. Which one do you want? I've got the baby car, the fire car, the blue car, or the red car.
I want the red car.
Where are you going to lunch today?
To the beer joint.
So I just like to show that because after some therapy work, he has a little bit more of a natural flow to his voice, which is always wonderful to see. Do you guys have any questions so far? Are we good to move forward? Okay. All right. So I'm going to move into some treatment options. My recommendation based on Cash's diagnosis and where he is would be therapy 3 to 5 times a week for 30-minute sessions. It would be goal oriented. So as he's working through these sessions, we can definitely look at making reductions in the amount of days he's coming or the amount of time we're seeing him. And as the parents, your priority always comes first. So we want to make sure that you guys are comfortable with what he's doing, how long he's here, and we can always work around that and figure out what you guys are comfortable with, as well as Cash and what he can kind of handle at his younger age. So see, these are some of the therapy options we would possibly use with Cash. I just wanted to go through them so you guys were aware of things he might be working on. Some options include sound movement exercises, which would look like we'd pick some of his specific sounds he's struggling with, and I would model them and he would follow. Movement is a very important part of childhood apraxia of speech, as moving those articulators and kind of getting them into the correct position for that sound can be difficult. So we like to work on that very early on. Another one could be vowel practice. If he's struggling with some of his vowels, it can make speech unintelligible. And as he is moving, you guys might not be able to understand him as his parents, but as he's moving into school age, where he might be speaking to people who don't know his speech as well and how he's talking, that vowel practice piece can be very important so that he feels confident in using those vowels in his speech so it sounds a little bit more intelligible to people so he can communicate his needs and wants. Word and phrase speech drills. We don't always want to work on drills just because it can be frustrating to some children. When you're drill practicing, we like to make it more of a successful experience. However, word and phrase speech drills are important to make sure that he is generalizing the information, which would just mean we're working on those sounds and that movement in therapy, but we want to make sure he's moving it into an outside setting outside of therapy. He's not just thinking that that's where he has to be doing it. And then when he gets to school, he can just, fall back into the way he was doing things. And as well to make sure that he's meeting his goals and we're working through therapy in a correct and projecting forward manner. Another possible therapy option would be multisensory input, which is a tactile input. I have another slide on this next that will kind of go into what a specific therapy session with this would look like. But this, like it says, would be tactile, which means we'd be applying kind of a touch, like some examples would be using a tongue depressor to physically move his tongue or some around his mouth so that he is getting those speech sounds and he can feel the movement, which is super important to getting those specific speech sounds with childhood apraxia of speech. And I'll kind of go into that a little bit more in a second. And then once again, prosody training, as you saw with that little boy, just working on making sure that speech is sounding natural and progressing forward. So I will show you a little therapy example. This would be for multisensory input. A session with therapy for this would be we'd pick a specific sound that he would be working on, or phrase, whatever we are doing, some words that would be important in his vocabulary. And we would first give him instructions, we would model the sound, and then we would use our specific tactile input, whether that is with the tongue depressor, kind of showing early on how to move that tongue, or if we're using pointing, which could be like telling him to pull his lips back or pointing to a specific part of his mouth so he knows he's being kind of instructed where we are in the mouth. And then I would model, he would repeat, and then we kind of give feedback and work on, oh, let's pull our tongue back, or let's, push that tongue back with the tongue depressor. Just giving that tactile input can be really helpful with children with apraxia of speech, just because seeing that movement and feeling that movement can give a little bit more feedback than just hearing it. So like I said, this speech therapist up here is kind of pulling her lips back, showing the little girl how to do that, or the tongue depressor. And then I have this little video to show a possible therapy technique we might use with Cash on how some of his specific sounds.
Hi, I'm Meredith from Peachy Speechy. And I'm Deacon.
If it will load, we'll see. Let's see if I can get it. Well, it might not. That's okay. I can kind of explain it. Basically what it would look like is she puts a little piece of cereal at the bottom of his tongue, kind of behind his teeth, and he's instructed to put his tongue against the cereal, and he's working on his K's and G's. So when he's holding it there, it's naturally putting his tongue into the movement of where it needs to be positioned to say that letter. And then he is instructed to say it. And as a reward, he gets to eat the cereal. this is a great multisensory input tactile therapy technique we would use just because it's a reward. It's kind of rewarding him, but it's also fun and it's getting his tongue into the correct position so he can feel that movement tactily. So it's something we definitely would encourage using. Do you guys have any questions after those couple of slides? Good. Okay. See if I can get it. All right. A lot of parents have questions about what they can be doing at home with their child. I do encourage at home practice. It's very important with repetition to be, we're seeing him 3 to 5 times a week, possibly for 30 minutes. But on those days that we're not seeing him, it is important to keep up that work of, practicing that movement with him and kind of the sounds he's working on, just so he can keep progressing forward when we are seeing him. So we really encourage repetition. A lot of times what it would look like is after a therapy session, we would send him home. We would give you guys some instructions on the words we're working on or the sounds we're working on and kind of some techniques on how you could practice that. We like to promote success, not failure at home. So if he's not, in a good mood and he doesn't really feel like practicing, we definitely don't want to push him. But promoting success and working on those sounds can be really helpful as that in-between repetition. Practice, you guys won't have all the therapy techniques that we would be using here. So it's more just like if you have 2 minutes before bed or before bath time or when he's brushing his teeth and you can think of some words or you're reading a book just to kind of get him to practice some of those sounds and movements so he can keep progressing forward and generalizing that information as well. And then some work at home you could be doing with AAC, which I will explain a little bit more about that on the next slide. But working with AAC is a really positive thing, and it has a lot of good benefits, and I'll kind of explain that. But definitely at home, using that AAC device could be really helpful. So I'll go into the AAC technology that we'll use in therapy, and he could use at home. So the first thing that he would be using in therapy, we would like to use in our office would be the Lingraphica AAC. So AAC stands for Augmentative Alternative Communication, and it's basically, if you look at this picture, just a communication board we would use. It will supplement his speech. We always like to say it's not hurting speech. It's not taking away from speech. It is just another way for him to communicate if he feels like he can't get those sounds out, those words out. In a lot of ways, it's giving, categories and concepts of things he might want to say, just to make it easier for him to communicate while he's also building on top of it his speech. So on this board that we use in therapy, we might use it to talk about his favorite foods or his animals at home, just so he has a way to communicate with us and feel like he's getting his ideas across as we're also building that speech part on top of it. So we would be using the Lingraphica here. And if you guys are interested in using AAC at home, we can definitely kind of get some quotes and insurance policies on how much it would cost to get a device at home and what that would look like. But you guys can discuss that and we can, talk about that further later on, should you choose to do something like that. But I also like to discuss some easier options for AAC at home. If you aren't interested in purchasing a device. The first one is this Visuals to Go. This is directly on the App Store, so you only need a iPhone or an iPad. I really like this. I actually have it, so I can show you guys a little demo of what it would look like to use this. Let me get it pulled up here. So this is what it looks like. It's gonna be a little hard to see. This one is a little bit simpler than the next one I'll show you guys, but it has just a couple different like concepts. So you can talk about sentence starters like I want. It has chat, feelings, foods and drinks, just a lot of basic ideas that he might want to share, and he might not be able to get that speech out. So it's important that he has a way to kind of, press the button, show you this is what I'm trying to tell you, and then you guys can work on speaking together with that, especially some of those target sounds he's working on. And I like that it has a little sentence bar so we can put some of those ideas together and work through those. So that one's a great option. It's free on the App Store, and I definitely recommend using that at home with him to aid his speech with communication. The next one that I will show you guys is called Avaz. This one also is on the App Store. It's free to purchase. This one's a little bit more complex, so it has a couple more buttons. It can also use expressive voices. So if he's in an angry mood, he can turn on his angry expressive voice, which I think gives kind of some characteristic. But you can do is change his tones. It has a couple more buttons and features. And it has a keyboard. So if he wants to physically type out his own message, I like that this one has that feature, just so he can communicate those things that he might not be able to verbally tell you guys at this point as we're working on his speech to aid his communication. It's pretty easy to use, and I highly recommend from his earlier age to kind of look into that, possibly bringing that into the home to help him. Finally, if you don't have an iPad, an iPhone, or you just kind of like the idea, we do use low tech in therapy as well. This is just an example of what it would look like. We'd print out pictures of some of his favorite things, of some starter sentences, and he could just point to the pictures and kind of put them together and then work on communicating, this is what I want, and then we can work on speech on top of that. This is just more of a low tech, simpler option as well, but it is very highly effective when we like to use it. So we could look into bringing that into the home as well. Finally, I was just going to show you guys a little video of this child with apraxia who uses an AAC device, just so you can see some of the benefits of using that technology early on, and they'll talk about it a little bit.
So can you introduce yourself to our friends?
How are you?
Fine. How are you?
What's your name?
My name's John. What's your name?
My name is Evelyn.
Good boy.
Apraxia is part of his neurodevelopmental complexity. And so apraxia is a disorder of motor planning. We usually think about childhood apraxia of speech for Emmett, which is a disorder related to motor planning for the purposes of speech. And so expressive language has always been a struggle for him.
Once he developed past that point where, children were starting to make sounds and words and communicate, and he was coming to terms that he couldn't, it was just a frustration that he wasn't doing what other kids were doing.
It's really important to enable them to have a way to talk to others, whether it's their parents or their friends in school or teachers, to communicate things that they need, things that they want, and also to start to engage socially. And so AAC can be helpful in order to support that.
All right, I just want to show you that little clip so you can see kind of how AAC is helping Emmett and how it could possibly help Cash should you choose to kind of implement that into your home. So do you guys have any final questions? All good. All right. Well, I just want to thank you guys so much for coming to this consultation. If you have any questions following this, please don't hesitate to reach out. And I'm going to stop sharing and hopefully stop recording.